Hello everyone, my name is Ada and I'll teach you some medical vocabulary. This lesson will introduce you to some basic medical terms you need to know, like wound, cure, heal, disease, and more. These terms will help you to describe medical conditions and emergencies that will be very useful, especially if you're traveling in an English-speaking country, or if you want to work in an English-speaking hospital. Now, all of these are our topics. We will start from the very basic, and as we advance in this course, we'll increase the difficulty. First of all, we have medical grammar and vocabulary, which is today's lesson. We'll talk about injury, illness, and disease. Tomorrow we'll talk about medical vocabulary, parts of the body mainly, medical and paramedical personnel and places, systems, disease, and symptoms, and at the end of all of these topics, we will practice. We'll have a practice class and then a final test. Every time we finish a lesson, you'll have a little quiz. It's very simple. So please pay attention, and if you want, you can go back to the video so you can listen again and take note of the keywords I'll be giving you. Today's lesson is a bit more practical. You might want to know some of these words. We're going to look at some medical vocabulary and to talk about issues that your patient could be facing. Okay, now how do we define medical vocabulary? Well, medical vocabulary can be also known as medical terminology. It is the language we use to describe components and processes of the human body, medical procedures, diseases, disorders, and pharmacology. Simply put, it is the vocabulary that medical professionals use to describe the body, what it does, and the treatments we prescribe. First of all, let's break down the medical vocabulary into 3 sections. We have injury, illness, and disease. First thing to understand, an injury is always about the physical body, okay? It's bones, it's tissues, it's skin, all these things. Illness, on the other hand, is inside the body, but it's usually shorter. I mean, it doesn't last a long time, and you can usually get rid of it. You can fix it somehow. Diseases, on the other hand, they are also inside us, but they can take a long time, and quite often they can kill our patients. Some diseases, there's no cure for them, but they have a treatment, and some, they do have a cure. Those are the differences between illness and disease. To sum up, illness is a short-term problem and disease is a long-term problem. So now let's start with injury. An injury to our patient's physical body can come in different forms. All of these are called wound. Wound, it sounds like an U sound, like in wood or could. And a wound is when you do something to physically harm your body, like when you fall down and scratch your knees. But what's the most accurate definition of a wound for us to understand? A wound, by true definition is a breakdown in the protective function of the skin. I mean the loss of continuity of epithelium with or without loss of underlying connective tissues like muscle or bones, nerves. Those are not involved. For example, a cut, chemicals, heat, cold, friction, pressures, those things can cause a wound. But which are the most common types of wounds? We have abrasion, laceration, puncture, and avulsion. The first one occurs when your skin rubs or scrapes against a rough and hard surface. Road rash is an example of an abrasion. There's usually not a lot of bleeding, but the wound needs to be scrubbed and cleaned to avoid infection. But what about laceration? Well, this is a deep cut or tearing of your skin. It can come with bleeding, and it is most commonly caused by knives, tools, and those sharp things. A puncture is a small hole caused by a long pointy object such as a needle, and sometimes may not bleed much. An avulsion is a partial or complete tearing away of skin and tissue beneath. Avulsions usually occur during violent accidents such as body crushing accidents and gunshots sometimes, and they bleed heavily and rapidly. Now a burn, like an sound, not an U sound, burn. If you touch the stove, for example, or you're peeling out bread from the oven and you touch it, or the stove, you're cooking something and you touch the hot plate, you'll burn your hand. So if in this case your patient says he or she has burned their hand, it'll hurt a lot, but you can put some ointment on it. An ointment is a semi-solid preparation, usually having a base of an oily material. It is almost like a cream somehow. This is just an example because we all know there are lots of different types of burns and there is a treatment for each one of them. But which are the most common type of burns we know? Most people can recover from burns without serious health consequences, depending on the cause and degree of the injury. More serious burns require immediate emergency medical care to prevent complications and even death. There are 3 primary types of burns: first, second, and third degree. Each degree is based on the severity of damage to the skin, with first degree being the most minor and third degree being the most severe. Burns have a variety of causes, including scalding from hooves, boiling liquids, chemical burns, electrical burns, fires including flames from matches, candles, and lighters, or excessive sun exposure. The type of burn is not based on the cause of it. Scalding, for example, can cause all 3 burns, depending on how hot the liquid is and how long it stays in contact with the skin. Okay, now a break, for example, if your patient had an accident and he or she falls and puts too much pressure on their leg, it is very likely that their leg will break. Or when someone is like trail biking and fall down, it's probably that that person breaks their leg or arms or something. But in our medical vocabulary, a break of any size is called a fracture. If the broken bone punctures the skin, for example, it is called an open fracture or a compound fracture. A stress fracture is a break in the bone that develops because of repeated or prolonged forces against the bone. The repeated stress weakens the bone until it finally breaks. But you can also fall and sprain something. A sprain means almost a break. Like, for example, you fall down on your ankle, like twisting it. If you fall down on it, you won't break your bone, but it will get all swollen. That's also another word you can add to your vocabulary. It's when it puff up, it'll be red or kind of bluish and be very, very painful. And maybe that person won't be able to walk on it, but he or she didn't break anything. So again, a sprain is a stretching or tearing of ligaments. But there's a word which is very similar to sprain and which we can be confused about. This word is strain, and the difference between a sprain and a strain is that a sprain injures the bands of tissue, the ligaments, that connect two bones together, while a strain involves an injury to a muscle or to the band of the tissue that attach the muscle to a bone. Next, we have illness. Now, everybody gets ill at some time. If you say sickness, it may mean the same thing in some cases, but we'll see their difference later. For example, we have things such as cold, have a cold with sneezing and coughing and more symptoms. Your patient can also get a flu, which usually comes with a fever. Many of you know influenza, so we just say flu for short. This illness eventually goes away, and we also have a vaccine for it. We often hear about a bug. Now, when we talk about a bug, we are talking usually about a virus. So we say there's a bug going around. So during certain times of the year, you'll get on the bus and somebody on the bus is sick or somebody coughed and then grabbed onto the handle. Then you come on the bus and you grab the handle. The virus comes inside you, and then the next day you're ill. You have a flu or you have a cold. So we say there's a bug going around. Now, a disease is a very harsh thing, okay? There are mental diseases, there is physical diseases. Something that is chronic means that it continues for a long time. It doesn't go away. Like, even if I have a chronic cough, it means I'm always coughing. It doesn't go away. Then, if you get tests, or in this case, your patient gets tests, and you find out that, for example, he or she had a tumor, let's say, and you think maybe it's cancer. So after testing that tissue by a biopsy, you find out it is benign. It means it is not dangerous. It's not going to do anything bad to your patient. It won't develop into the disease. But then there are some diseases that are terminal, and terminal means end. So basically, if your patient has a terminal disease, it means that eventually will pass away because of that disease. Cancer sometimes is a terminal disease in most cases, In some cases, it goes away for a while, but it can come back, for example. Now, what do we do with each of these situations? Well, we heal injuries, okay? A patient comes to us, we examine him, and we, for example, fix his arm, or we take care of a swollen ankle, and then it eventually, after a little bit of time, will heal. For an illness, our patient comes to us and we examine and get a diagnosis. Then we prescribe a remedy for their treatment. We'll talk about different types of treatment another time, but a remedy is something we use to fix, let's say, an illness. Remedy can be a noun, like for example, when you go for a remedy, or a verb, when you can remedy the illness. Now, a disease, you treat it over time. You apply the treatments you believe are the best ones to treat the disease, expecting to cure at least, or at least to enlarge your patient's life. The word cure can be used as a noun and as a verb too. Well, cure as a noun is the medicine, the remedy we give to our patient so he or she gets rid of its disease. And as a verb, it is the verb to cure. It means the action, the thing we do for our patient to be cured. Lastly, when we talk about doctors, almost everybody thinks there's only one word, but no, there's not only one. There are plenty of ways to say doctor, but the most common we will hear is a physician, for example. A physician is somebody who takes care of sick people, so it's another way to say doctor. And of course, you can just go by their qualifications. MD, which means medical doctor, or doctor of medicine. Those are ways to say it. So here's a start to your medical vocabulary learning. Asking about health. Well, health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as, how's your health generally? Or what is your health like? Now, if you're in good health, it means that you're well and have no illness or disease. If you're healthy, you're normally well and can resist an illness. And if you're fit, you're well and also strong. Now, sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases. For example, sleeping sickness. The sleeping sickness is a tropical disease, and it is caused by a parasite. We also have, as an example, travel sickness. It is also called motion sickness, which causes dizziness and a little bit of nausea. Sickness, when they mean nausea and vomiting. For example, if a patient says, I was sick this morning, it could possibly mean it was that he felt ill this morning, or he felt unwell this morning. Or maybe that they vomited this morning. Or when our patient says, I feel sick, what could it mean? Well, this could mean I feel ill, I feel unwell, I'm nauseous, or I feel the need to vomit. So these are the ways we commonly use the word sickness. Now, recovery. When our patients are recovered? Well, when patients return to normal health after illness, they have recovered. But we can also say the patient made a good or full or a complete recovery. If a patient's health is in the process of returning to normal, the patient is improving, or the patient's condition improved. But what happens if our patient is not improving? When that happens, we say the opposite, which is deteriorating, or condition deteriorated. On the other hand, in speech, we often use the verb get to talk about change, like get over an illness, it means to recover, or get better, which means to improve, and get worse, which means to deteriorate. For example, he got over the illness very quickly. If a patient is better but then gets worse again, the patient relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. For example, 2 years later, she remains in complete remission. Now let's practice. Here you have 7 statements. In every statement you have 2 options and only one is the correct. Please take a piece of paper or your cell phones to write down your answers. Read carefully so you don't make mistakes. You have 5 minutes to complete the sentences and 1 minute to check your answers. So please start now. Her condition deteriorated and she died. Her condition deteriorated and she died. He recovered and was allowed to go home from hospital. He recovered and was allowed to go home from hospital. The cause of sleeping sickness was discovered in 1901. The cause of sleeping sickness was discovered in 1901. The patient made a full recovery. The patient made a full recovery. I have been in good health for months and feel very fit. I have been in good health for months and feel very fit. It was a month before I got over the illness. It was a month before I got over the illness. He seems to be rather unhealthy. His diet is bad and he never exercises. He seems to be rather unhealthy. His diet is bad and he never exercises. Thank you for joining this class. Tomorrow we will continue to lesson number 2. Good evening to everyone.